A new and highly contagious COVID-19 variant known as KP.3 has now become the dominant strain in the United States, according to recent data from the Centers for Disease Control and Prevention, CDC. In the 2-week period ending June 8, KP.3 made up 25% of COVID-19 cases nationally, surpassing the KP.2 variant, which accounts for 22.5% of infections. Both KP.3 and KP.2 are offshoots of the highly transmissible Omicron variant and belong to a newly identified group of variants referred to as FLiRT. These variants, though highly contagious, are not expected to cause more severe symptoms than previous strains, according to health experts. The KP.3 variant has quickly ascended to the #1 spot due to its remarkable ability to transmit from one person to another. It is very good at jumping from one person to another, stated Dr. Celia Alani Valdez, a pathologist and medical director at Regional Pathology Associates in Texas, in an interview with Health. Before the emergence of the FLiRT variants, the JN.1 strain, another Omicron subvariant, was the dominant strain nationally. The rapid rise of KP.3 highlights the ongoing evolution and adaptation of the SARS-CoV-2 virus. Despite the increased transmissibility of KP.3, current indications suggest that it does not cause more severe illness than previous COVID-19 variants. Hospitalizations and deaths related to COVID-19 remain relatively low, as do the overall infection rates, even as the KP.3 variant spreads. The CDC continues to monitor the situation closely. CDC predicts that KP.3 is growing and will become the most common SARS-CoV-2 lineage nationally, a CDC spokesperson said. CDC predicts that KP.3 is growing and will become the most common SARS-CoV-2 lineage nationally. In response to the changing landscape of COVID-19 variants, the U.S. Food and Drug Administration's Vaccines and Related Biological Products Advisory Committee recently voted to recommend a monovalent COVID-19 vaccine for the fall that targets the JN.1 variant. The CDC and the Advisory Committee for Immunization Practices will discuss and vote on these recommendations on June 27. Although KP.3 has a few mutations compared to JN.1, experts believe that a JN.1 targeted vaccine will still provide significant protection against KP.3 and other FLiRT variants. The greatest amount of protection is likely to be for people who have not been vaccinated recently or who have not had an infection in the last year, said David Engelthaler, who leads the Infectious Diseases Division of the Translational Genomics Research Institute in Arizona. In Arizona, KP.3 has been detected since early May, with about 12 cases identified through the Global Initiative on Sharing All Influenza Data (GISED) database. However, this number likely represents a small fraction of the true prevalence due to the decreased amount of viral sequencing of positive tests compared to the height of the pandemic. Health experts advise Arizonans and the general public to remain vigilant, follow CDC guidelines if they experience symptoms, and consider vaccination as a key measure to protect against severe illness. The emergence of the highly contagious KP.3 variant underscores the dynamic nature of the COVID-19 pandemic. While it is now the most prevalent strain in the U.S., ongoing surveillance, vaccination, and public health measures remain crucial in managing the spread and impact of COVID-19.